Nociception is the activation of specialized nerve fibers and receptors, called nociceptors, in response to noxious or harmful stimuli such as heat, cold, pressure, and chemical stimuli. When our bodies detect a noxious stimulus, the autonomic nervous system jumps into action and the heart beats faster, blood pressure rises, and the hypothalamic pituitary axis is activated. Pain is a phenomenon that clearly exemplifies how important taking a biopsychosocial approach can be. Some cultures interpret pain differently and may have different ways to cope with it, but in all cases, pain serves the same purpose. It tells us when our brain thinks something in or on our body is damaged. Cultural variations in pain expression are due to differences in socialization and expectations across different cultural groups. For example, many males are socialized to not express themselves when experiencing pain, and females are socialized to express pain when they need to. This is consistent across many cultures. There are also different expectations for pain tolerance across ethnicities and races. For example, one study found that Middle Eastern women were likely to scream more frequently during labor than Japanese women. This is just one example of a cultural difference in pain expression. Members of different ethnic groups give very different meanings to the experience of pain. These differences take the form of when pain should be expressed, how the pain should be expressed, what the expression of the pain signifies about the individual, and how long the pain should be expressed. Researchers found that overall, Black Americans, Asian Americans, and Latino and Latina people had higher pain sensitivity compared with non-Hispanic white Americans, particularly lower pain tolerance and higher pain ratings. Treatment disparities were less for Latino and Latina people for traumatic and surgical pain, but remained for non-traumatic and non-surgical pain. Treatment disparities for Black people remained consistent across the different settings and pain types. Some ethnic groups may have language barriers that influence the success with which the patients convey their level of pain or understand the doctor's instructions. For example, Latino and Latina people are the fastest growing ethnic group in North America, but have experienced decreasing economic and educational levels and are underrepresented in those who have health insurance. Acute pain refers to short-term pain. Chronic pain refers to long-term pain. If chronic pain is associated with a disease such as cancer, it is referred to as chronic malignant pain. Acute pain can last for minutes, hours, or even days or weeks. Acute pain is also measured differently. For example, the acute pain taxonomy is a multidimensional acute pain classification system designed to classify acute pain along multiple dimensions. Chronic pain, on the other hand, often persists for months or even years and is now considered a disease by some pain organizations, such as the European Federation of the International Association for Pain. Psychogenic pain is a term used to describe pain that is primarily influenced by psychological factors. This type of pain is real to the sufferer, even though it may not have a clear physical cause. It's important to note that calling pain psychogenic doesn't diminish its reality or the distress it causes. Psychogenic pain can result from mental health issues like anxiety, depression, and stress. While the pain is initiated or exacerbated by psychological factors, the suffering is very real and can be just as debilitating as pain from a physical injury. Neuropathic pain arises from damage to or dysfunction of the nervous system. This type of pain occurs without direct harm to the nociceptive, pain-detecting system, but involves the misinterpretation or abnormal processing of nerve signals. Neuropathic pain can manifest as a burning sensation, shooting pain, or numbness, often without an obvious injury or damage to the tissue where the pain is felt. Somatic pain usually involves tissue damage or potentially harmful stimuli that activate nociceptors. Somatic pain originates from nociceptors in the body's tissues, signaling actual or potential damage to those tissues. It's typically well localized, meaning individuals can usually pinpoint where the pain is coming from. Common examples include the pain of a cut or a broken bone. Understanding pain involves grasping 4 key physiological processes: transduction, transmission, modulation, and perception. These processes form a continuum from the initial stimulus to the conscious experience of pain. Transduction is the first step in the pain process, where pain receptors convert various forms of noxious stimuli into electrochemical signals. This conversion is crucial as it allows the body to initiate a rapid response to potential or actual tissue damage. The process involves the activation of pain receptors by stimuli strong enough to breach their threshold, leading to the generation of action potentials that signal the presence of pain. Following transduction, the next step is transmission, where the generated nerve impulses is relayed from the site of stimulus along the sensory nerve fibers, also called afferent fibers, to the spinal cord, and from there to the brain. Substance P, among other neurotransmitters, plays a significant role in this process, facilitating the communication between nerve cells by transmitting signals across synapses. Modulation refers to the process by which the pain signal is altered as it travels through the nervous system. This can occur at various points, such as in the spinal cord, where the body's internal mechanisms can either increase the pain signal or dampen it. Neurotransmitters and other chemicals in the body play a vital role in this process. The main parts of the nervous system involved in modulation are the frontal cortex, hypothalamus, periaqueductal gray matter, reticular formation, and medulla in the brain and the areas of the spinal cord. Perception is the final step, where the pain signal reaches the brain and is interpreted as the subjective experience of pain. This is where pain becomes a conscious experience, influenced by many factors, including emotional and psychological states.